The fifth class of drug, they are called thiazolidinones. They are called thiazolidinones, right? So in that we have two drugs. One is called the pioglitazone. The drug name is pioglitazone, and one more drug is by the name rosiglitazone. Now rosiglitazone has been withdrawn already because this drug has increased cardiovascular deaths. So because of that, this drug is being banned now. Nobody uses this. So what we have in India is only pioglitazone. Now, how this pioglitazone is going to work? Let us understand the mechanism of action. How does it work? Now, pioglitazone, let me write as pios. It will stimulate. It will stimulate PPAR gamma. So it will stimulate PPR gamma, and minor, it will also stimulate minor activity is on PPAR alpha. It is very much minor. The major action is on the PPR alpha. So what happens? You know that PPR alpha is a nuclear receptor, and when it is stimulated, it increases the expression of insulin response genes. So it increases the expression of insulin response genes, and because of this, what happens? It increases insulin. It increases insulin sensitivity. So it increases insulin sensitivity, and the major site of action of this is in the adipose tissue. If they ask in the exam what is the major site of action of these drugs, that is pioglitazone, it is mainly on adipose tissue. That is a major site of action. Now, since it has PPAR alpha action, so what has the advantage? It increases HDL, it decreases triglycerides, and it has no effect on LDL. No effect on LDL. So that's why this drug, pioglitazone, has shown some benefit. It has shown in some benefit in atherosclerotic cardiovascular disease. There it has shown some benefit, that is pioglitazone. And you know that since it increases insulin sensitivity, the drug is majorly used in a patient who has diabetes type 2 with, if he has having insulin resistance, then we use this drug. So diabetes type 2 with insulin resistance, then we can use this drug pioglitazone. Suppose you have put the patient on other drugs for diabetes and he is not responding, he is known to have insulin resistance, then we can start this drug pioglitazone. Now, what is the problem with the drug? Even it's a wonderful drug, but what is the problem? The problem is the drug causes weight gain. So weight gain. Second, it causes sodium and water retention. So it increases sodium and water retention. So which condition it should not be used? Obviously, the major condition where you should not retain sodium and water is in congestive heart failure. So in congestive heart failure, obviously this should not be used. So sodium and water retention will increase the risk of edema. So don't use that in CHF. And also it has shown to increase the risk of a cancer that is called bladder cancer. Not everybody will get this bladder cancer, particularly the patients who have family history and who comes with bleeding per urethra, then you should be very careful. So that's the reason this comes with a black box warning. Doctors should take these histories before prescribing that. If they have family history of bladder cancer, if they have bleeding per urethra, then don't give this drug. And some rare adverse drug reaction, it has increased the risk of fracture in females. Particularly in females, it has increased. And very rarely, in certain individuals, rarely, It is a rare adverse reaction. It has caused macular edema in certain individuals. It is going to cause macular edema. So that is about the drug pioglitazone. Moving on to the next group of drugs,